What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey, joined by my friend and co-host Keoni Tita. Keoni, how are you today?
I'm good. Hi, everybody. Thanks for joining us again. I'm really excited about this series that we're doing right now. This is part 2 of our diabetes series, and we're going to try to wrap up with part 3 in the next episode. But just to review what we talked about last time. Last time we talked about the difference between type 1 and type 2 diabetes. I think the main takeaway there is, type 1 diabetes is where you're completely insulin dependent. As soon as you're diagnosed with type 1 diabetes, you need to be put on insulin. Right now, there is no cure for type 1 diabetes. I think that's going to change, though, real soon here. Type 2 diabetes is, if there's a better form of diabetes to get, this is the one because you're not dependent on insulin if you can control it. And the other thing about it is it's also curable or reversible, or in medical terminology, how they don't like saying cure. They'll say, well, it goes in, you can put it into remission and you can keep it in remission. It's pretty easy to do that. So we're going to focus on type 2 diabetes, but we talked about the difference of that last time. Last time we talked about glucose regulation and just how the metabolism, how it works, how diabetes develops. And basically, it's poor lifestyle. And I would say the main culprit of that is basically eating poor quality of food and eating too much. So as you eat each meal, you get a little, and if it's poor quality food and refined, your blood sugar goes up. After a while, your insulin levels go up. If your blood sugar stays high and your insulin levels keep creeping up, over time, your cells become resistant. So now that sugar stays around your blood. So then you get what's called high blood sugar. And if it's high enough, it can be diagnosed as diabetes. You do not want that because high blood sugar damages tissues and significantly accelerates aging. So that's all the stuff we talked about in a nutshell last time. So this podcast, I want to talk about, well, how is it diagnosed? And then I want to go into the natural treatments of how I go about treating it, and some of the nutraceuticals out there and herbs that can really help. And then in part 3, I want to talk about some of the medications.
All right.
Of that, the prescription meds. So let's
So
jump
how do we
in.
get it diagnosed?
Yeah,
How does someone find out?
so the diagnosis of type 2 diabetes, the conventional diagnostic criteria, there's a few ways. So one of them is if you have a fasting blood glucose of 126 milligrams per deciliter, or greater, okay, it's considered diabetes, and it's considered diabetes not just on one test. You have to get a number of tests for that. Another way is if you have a non-fasting glucose of 200 milligrams per deciliter, or greater than that with diabetes symptoms. Okay, again, you need to have more than one reading.
Okay.
You can also diagnose it by having a blood glucose of 200 milligrams per deciliter or greater 2 hours after a 75 gram oral glucose bolus. So they give you 75 grams of glucose, and then they see what happens to you in 2 hours. And if it stays elevated above 200 milligrams more than one time, then they'll diagnose you with that. The easiest way to diagnose it, and I think this is what most doctors are doing, is just running the hemoglobin A1C. And we glycated hemoglobin A1C, talked about it last time. But anyway, this hemoglobin is in your red blood cells, and we're just looking at the sugar coating on it. So we call it glycated. Glycation is the mechanism of how sugar binds to protein. In this instance, we're talking specifically the protein of hemoglobin. And if it's 6.5% or greater, it's diagnostic of diabetes. To be considered pre-diabetes, 5.7 to 6.4 is considered pre-diabetes. You run this one once every 3 months. You can run 2 of these same tests to get diagnosed with diabetes, or you can run one of these and then run another one. So you have two things to back it up. And this should be, so again, these should be repeat tests on separate occasions, and then therefore you can be diagnosed with diabetes. Diabetes is very, very common. Prediabetes is even more common. And there's a lot of things that go with that. One of the things with diabetics, and we talked about this last time, is, if you are pre-diabetic or have diabetes, you probably also have a condition, what's called fatty liver. We talked about this, Brian, on a podcast. I forget when, but way back when. Just so you guys out there listening, you just just look up fatty liver podcast, and you should find it on the Wellman's site. But I definitely recommend listening to that, because that is part of my treatment. We will definitely make sure the liver is healthy also, because we talked about last time how the liver is really a main organ of glucose metabolism.
Right.
It's not only about the pancreas. What else here? Heart disease is another thing, right? So fatty liver, heart disease. And then we talked about insulin, like high levels of growth hormone. Insulin is a growth hormone. And the more insulin you have, the fatter you're going to be. This is one of the reasons why people, especially type 2 diabetics who have to inject themselves with insulin, they will see a lot of weight gain with insulin levels. You're forcing that sugar into the cells and all that energy, and that sugar can be converted and stored away as fat. So we talked about this last time, is, the treatment for diabetes, at least conventionally, it's probably necessary in some instances, but in the long term, it's exactly the wrong thing you want to do for treatment. All right. It is the thing you have to do for treatment if you can't get the symptoms under control, though. So it's unfortunate, right?
Yeah.
But the nice thing about this podcast and the podcast about just talking about diabetes, type 2 diabetes is absolutely curable. Okay. The more you have it, the longer you have it, the harder it is to reverse it. So you really want to get a handle on this as soon as you can. And it's insidious on how it creeps up. I've had patients who 1 year they go in, they get a regular blood test, everything's fine. The next year they're being diagnosed with diabetes. I mean, it can happen that quick. So, and I've had patients where they found it, they reversed it through diet and lifestyle, and then they forgot about it. And again, what happened to them? They became diabetic again. So once you have diabetes, it's very easy to go right back into that. So you really have to make a significant lifestyle change to reverse that. What else here?
Keoni, as far as like you were saying, kind of you're more, I guess, predisposed to getting back towards those diabetes levels or diabetic level if you've already had diabetes. Is that just, you're saying if you're not super mindful of your lifestyle choices?
Yes.
Or, okay.
Yeah, you have to be super mindful of your lifestyle choices. You have to stick to healthy lifestyle choices. And the main things that we talk about as far as that is making sure that you're eating high quality of food, making sure you're not overeating, making sure you're spacing it out. We'll talk about intermittent fasting as part of my treatment protocol for it. Getting plenty of sleep, and then making sure that you exercise to pull the sugar out of your bloodstream, right? When your muscles work, your muscles are, starved for sugar, and they become very insulin sensitive almost immediately if with exercise. Somebody who exercises on a regular basis is very insulin sensitive. It's going to be it's difficult for them to get diabetes. Not to say that it can't happen, but when you exercise, you pull that excess sugar out of the bloodstream because your muscles need to use it. So
imagine if you're fasting on top of that too.
Right. And then imagine if you are also eating a low refined carb diet. It's very easy to, you do all three of those, it's very easy to reverse. And then I'll talk about towards the end of this podcast, some of the things I do as far as nutraceuticals that really, really help. One thing I tell my patients is, I don't just, of course I want my patients to be out of the diabetic range as far as glucose levels, fasting glucose levels, and hemoglobin A1C. but you really should work for optimal levels. So an optimal fasting glucose is 85 or lower without any low blood sugar symptoms. Okay. So it's like an 8-hour fast. You should have an 85 or lower blood glucose. I know the standard levels on a blood lab are like 90 to 100. Your doctor sees that. They're saying you're normal. And then hemoglobin A1C, I think anything under 5% without low sugar symptoms is great. So between 4 and 5% is really optimal, is really what you want. So those are the things that you're looking for. Let's see. Conventionally, to get yourself out of diabetes, you want a hemoglobin A1C under 5.5%. Okay, so I just tell people that let's get first, and then we can think about where we want to go. Now, one of the tests that I will also do is I'll do a fasting insulin too, and I tell my patients, and again, this is really crazy, Brian, because the fasting insulin level, I mean, I think the top number for that considered normal is anything under 24. Anything under 24, I think micro IUs per milliliter or less is considered okay. That is crazy. I mean, you really want a fasting insulin level of optimally under 3 or less. Okay, so I just tell people, like, as you become insulin sensitive, you'll see your fasting insulin levels go down. But I run that with my patients. And on top of that, I'll run some of the inflammatory markers too, because we know that diabetes is just kind of stokes inflammation in the body and is a big cause of it. So I'll run inflammatory markers like a HSCRP and homocysteine. We had a podcast on that way back, like maybe it was 3 years ago, where we talked about like anti-aging blood labs that we do. So yeah, you remember that? So those labs are the things I run because for the main thing is because of the sugar. I mean, one of the things to slow down aging is to really control your sugar levels. So with diabetes, we want to make sure that we are reducing cardiovascular complications. When you have diabetes, not only do you have the fatty liver and cardiovascular complications, but the main things are you see also on blood labs, not always, but you'll see blood pressure go up and you'll see blood lipids also go up. So controlling blood pressure and lipids are a very big part of helping with diabetes treatment. The conventional recommendations for blood pressure targets are between 130 for diabetes, between 130 and 140 systolic and 80 millimeters of mercury to 90 millimeters of mercury diastolic. Optimal. On our blood pressure podcast, we talked about there's been no indication of any stress on the arterial walls with a blood pressure of 115 systolic and 75 diastolic. So every time the heart beats, you are putting shear forces on the arteries, and that's every single time it beats. So anything above 115 systolic over 75 causes a microinflammation, a little bit of inflammation. Over time, your body has to control that and kind of, get the handyman out, so to speak, of the arteries, and they go in there and start plaquing it up with like cholesterol or whatever. And then over time, it makes the arterial walls less compliant. They become less flexible, if you will. And when that happens, your blood pressure can go up. So we
got a lot of handyman in America. You can't find a contractor for save your life.
Well, you need to. Yeah, that's right. So you can't expect your doctor to help you. You got to be your own handyman when it comes to your health with this stuff.
Excellent point.
And yeah, so I tell people that's one of the reasons why when a patient comes in, they're diagnosed with diabetes, and I know you've seen this with your patients. They're on all these different drugs. They're on sugar-lowering drugs, insulin, glucophage, metformin, also high blood pressure meds, a couple of them usually, and then cholesterol lowering meds usually. And then sometimes they're on blood thinning meds too on top
That
of that.
sounds
So
about
after,
right.
yeah,
That sounds
so
very
that's,
common.
yeah, now you're on like anywhere from 3 to 7, 8, 10 different meds, all for um, the root cause of type 2 diabetes. So if you get the diabetes under control, everything gets better. And then you can start weaning off meds, which I've seen over and over again in my practice. You can start slowly weaning off meds as you become more insulin sensitive. And it doesn't take a whole lot to change your lifestyle for the just making healthier choices. Optimizing your
Hmm.
lifestyle can reverse this. Um, any diabetic nutritionist is gonna certainly tell you this information that I'm getting ready to say. I agree with this. There's some things that I've heard them say that I don't agree with, but you really want to increase your consumption of vegetables and nuts and seeds, high fiber foods, whole grains, legumes, and fruit to some extent. Of all of those, though, I would say fruit is one of the things that you want to minimize. But all of those whole foods are things that you certainly can eat and should eat. You should avoid, obviously, the fast food, the junk food, the foods that are fat and sugar together, the things that we crave, but which make us feel like shit. We want to make sure that we are focusing on healthy food because in the long term they just make us feel better. One of the main things I stress: any sweetened beverages, both caloric and non-caloric sweetened beverages, I just tell my patients get rid of. All right. And I know a lot of my diabetic patients, but I love my diet soda.
Hmm.
There's this neurolingual effect where it can make you crave food later. There's some indication, we're not really sure what it does to the hormone mix going on in your body. When what does your body think when it tastes sweet but yet there's no calories there? Do you still get a secretion of insulin anyway? And in some cases you do. So I'm just telling people, like, avoid the sweet as much as you can, especially the liquid sweet, because we know that you can overeat when you're doing liquid calories. So that's really important.
Yeah, there tends to be a body type, Keoni, in the hospital that's like when they're exercising, I'm like, do you need any water? And they respond with, oh, I only like lemonade or something like that.
Yeah.
Tends to be a specific type of person
It's
usually.
it's crazy to me. I've actually heard a number of patients over the years, I hate water. I'm like, it's crazy to me because when you say something like that, you're like, man, you wouldn't even be here. None of us would be here
Yeah,
without water.
yeah.
Without water. But water in conjunction with fiber, a high fiber food, is very satiating.
Hmm.
So this is why fruit, especially whole fruit, as opposed to dry fruit, is
Hmm.
better for you, because you have the water and the fiber. It helps fill you up. Um, Also, the high fiber foods, they tend to be very low glycemic, so they don't spike your sugar. So high fiber carbohydrates, which includes fruit and legumes and whole grains and vegetables, nuts and seeds, they do very little to spiking your sugar levels up. And if you drink water with it, you can be very, very satisfied with it. The macronutrients that really do the best for helping control diabetes is protein, fat, and fiber. And so one of the things that I do for my diabetic patients is there's no way around living in the world that we do that you're not going to be eating processed food. All right. There are actually decent processed foods out there that are really good, that are very high in protein, fat, and fiber. And one of the rules that I tell my patients: anything that's boxed or wrapped in plastic or
Hmm.
whatever, like a protein bar or cereal or bread or anything like that, optimally you want to try to, look at the nutrition label on that food, and you take the total number of carbohydrates in one serving minus the protein minus the fiber, and that number should be 10 or less. And that will really help control blood sugar. You can eat like that protein bar, and then we'll talk about it in a minute, but if you check your glucose, you'll see that it does very little to spiking that, and over time makes you more insulin sensitive. I didn't say anything about fat there, right? Because fat is the one macronutrient that doesn't really seem to have a big cause a big spike in blood sugar. Okay. Now there's a caveat to that, because a lot of people with diabetes go, oh, well, Dr. Keoni said that I should eat low carb. So what do? They go straight to a ketogenic diet. All right. And that has problems, because the ketogenic diet, it can be good for some people and it may be good in the short term, but long term, if you're just eating a bunch of animal protein and fat, it can increase your risk of cardiovascular disease, increase your risk of, it causes inflammation. Protein, if you get too much of it, can contribute to diabetes. So you want to make sure of the macronutrients. The first one that you want to temper the most is carbohydrates, especially the refined forms of the carbohydrates, then protein, and then fat. So at least initially, maybe keto diet is fine, but I just tell people, I want people basically on a low glycemic diet. That should be the long term, the diet that has the most research on it, and you just get tons of phytonutrients, and everything else is the Mediterranean diet. So I think if people focus on the Mediterranean diet, at least once they have their sugar and insulin levels, hemoglobin A1C under control, that's a really good diet to go on. And there's an Americanized form of that, which is basically pasta and bread. I'm not talking about that. I'm talking about a diet that's high in legumes, whole grains, vegetables, fruits. Olive oil is the primary dietary fat. Includes moderate amounts of fish, dairy products, small amounts of red meat, but it's very low in processed foods and refined sugars. I mean, there's
Right.
numerous studies that show the Mediterranean diet is good for long-term health. But I tell people it's really not so much about the quality of food, even though I want all my patients to eat high quality food like you could find in the Mediterranean diet. The main thing that you want to think about with diabetes, type 2 diabetes, is putting enough space between your meals and not overeating. So it's really, think about reducing quantity. That has more power than just the quality of food. So for example, this may raise some eyebrows out there, but you would do better eating a diet of 2 donuts, 1 meal a day with diabetes, and you have just that one meal, than eating 6 meals or 7 meals a day, or 3 meals with snacks in between of healthy food, because you're putting space between your meals to where your body has to metabolically switch into burning fat and has to become insulin sensitive. The problem with doing the 2-meal donut, which can run, depending on the donut, can run up to 1,000 calories or more. The problem is that when you eat like that, you just crave more of that stuff later, and you can
Right.
tend to overeat later.
Keoni, what are some ways, I can think of a few that are obvious. You feel that full belly, but what are some ways that you may be overeating? And I know we did a podcast on binge eating before, which we can go listen to
Yeah,
if
it's
you'd like. But what are some of
it's
those? Yeah, how do you monitor that?
you know what? It's hard, because there is a catch-up effect. Your brain
Right.
can't really catch up to your stomach, especially if you're a quick eater. But one of the ways that you can slow yourself down is eating high fiber foods, drinking water during the meals. I can't tell you how many people don't drink water during the meals. There's some things out there that say, well, it decreases stomach acid, so on and so on. Well, what it does is it can add to that satiating feeling. So I'm all for drinking water. And if you want to even get a better full feeling, drink carbonated water, because now the CO2 in there adds to a feeling of being full. But the main thing is fiber. The main thing is fiber. So part of our intermittent fasting protocol, I call it intermittent fiber fasting, right? So basically, the meals that you eat, you're going out of your way to make sure that they are very high fiber, and
Okay.
you're drinking plenty of water. Those are the ways that will keep your brain kind of in line with your stomach, so you don't overeat. What I forget that Japanese expression, hare hachi bu. I think that's what it is. It's basically eat till you're 70 or 80% full. it's easier said than done, especially when you're really hungry. But if you get in the habit of eating slowly, that's probably the best way
Mm.
to keep your brain caught up to your stomach, and so your eyes aren't bigger than your stomach,
Hmm.
so to speak. So that's the main thing. High fiber is huge, and it's not just the satiating effects of fiber. When you eat high fiber foods, these foods are very high in what are called prebiotic fibers, and these prebiotic fibers, what they find is it's food for your gut bugs. And one of the things they're finding in research is these gut bugs, all billions of them that line your gut and help you digest, they actually can help you maintain a healthy weight. Very interesting studies on people who eat more refined food. They actually have gut bugs that extract more calories out of the food so that you absorb more calories than you normally would, whereas people who eat high fiber foods just don't. So that's a one great way that fiber adds to dieting. The other way is when these gut bugs chew on these fibers that you're eating your food, it also helps manage hormones. So, this whole gut microbiome thing is huge. And one of the very simple ways, without even getting into the science and all that, which I don't understand myself, but what I do know is when you eat a diet that's very high in fibrous foods, or follow that nutrition label rule with everything you eat, whether it's convenience foods or not, you're actually helping your gut bugs help you to maintain a healthy weight. Now, we also know fiber slows down the absorption of nutrients too, and slows down transit time, so you just feel satiated longer, right?
Right.
And based on fiber alone, you do get some optimization of hormones. Also, we talked about some of those the incretin hormones that your stomach and intestine secrete. Well, that you get a good amount of those helping you maintain optimal hormonal balance by having high fiber foods. Very important. And that's why I really like that nutrition label rule.
Right.
So total carbohydrate minus total protein minus total fiber, 10 or less is probably a good food that you can eat.
Okay. And that specifically, Keoni, in the context of like glycemic load, or overall, that is a good satiating food with a good balance between all those
Both.
macronutrients. Okay.
It's both. You know, um, I a little bit more on like animal protein and fat and the potential long-term risks. Low carbohydrate, high protein diets like the keto diet, for example, are a lot of times recommended for diabetics. And like I said before, in short term they may be helpful, but the long-term effects seem to be very negative. Low carbohydrate diets like the keto diet are actually associated with decreased insulin sensitivity over time. So remember, we want to increase insulin sensitivity.
Hmm.
They also increase the risk of death from all causes. And and we know this, like we know like high animal protein diets like significantly increase your risk of almost every type of cancer. So,
Well, I
and
know
I'm
it was
not,
all the rage there for a moment, Keoni, that
oh, it
carnivore
still
diet.
is.
Yeah.
Yeah, it still is, and I think there's a place for it. I do. I think that's why I think like a ketogenic diet for somebody who's trying to lower their hemoglobin A1C, as long as they don't overeat and as long as they do it short term. When I say short term, 3 to 6 months, six
Oh,
months at
okay.
the most,
Okay.
it can really help significantly. But we have this, when we see like good results from a diet like the ketogenic diet, right?
Double it
And
up, baby. Make it
double it
even
up, right?
crazier.
Yeah, double it up, make it even crazier, and that's not necessarily true.
Right.
So a low glycemic index type diet where you're eating Mediterranean type food, the Mediterranean diet, and low carbohydrate diet, they don't necessarily mean the same thing,
Mm.
and they could rely on different foods, like the ketogenic diet or the Atkins diet. Remember that? I mean, it's all about like, animal protein and fat, animal protein and fat. And in the long term, it's not a healthy way to eat. It's just
Right.
not. I mean, and the research really bears that out. Um, One of the things I recommend for not only my diabetic patients, I do it too occasionally, like once or twice a year, is self-monitoring the glucose. There's a number of ways you can do that. You can prick your finger. If you are diabetic, you absolutely need to monitor your glucose. I think the easiest way to do it is now get one of those glucose monitors that, it Bluetooth to your phone that you can just check it. You can check it 100 times a day, your sugar. And basically it's a little sticker that goes on the back of your arm. I think it's called one of them's called the one I use in my clinic mostly is called the Freestyle Libre glucose monitor.
Oh, well, no free shout outs.
Yeah. Yeah. But so for that, you do need a doctor to call it in and get it for you. But if you're diabetic insurance, I'm pretty sure it covers that. But it's great because you can wear that. I think they last 2 weeks. It's like a biometric device.
Mm-hmm.
It lasts for 2 weeks. You can use your phone, check your blood sugar. It's very telling for my patients, at least. They will see what foods affect their sugars the most. And it's very interesting. Some people go, I ate a potato and my sugar levels didn't really go up. And then I had a bowl of grapes and my sugar went through the roof. So I think it's really good for people to see that. Or they can get an idea of, well, normally when I eat this pizza and I have one slice as opposed to 3 slices, the one slice does very little to my sugar levels. But then when I have 3 over time, 2 hours later, my sugar is like 300,
Yeah.
So it's good to have. And it's less invasive than constantly pricking your finger. And we always have our phones around. It's the way to go. I recommend people wear it. For people who are really into this whole biohacking their bodies and slowing down the aging process, I think it's great to wear that periodically. Just go get one.
We'll have to come out with our own, Keoni, and we'll put your voice with it. And when that little clip of you saying, "Eat your salad, no excuses," that'll be the little notification.
I know. It's funny because one of my patients, or maybe it was Melissa, was telling me that what the patients were telling her that she had every time she opened the refrigerator door, there was a pig sound that came out, like an oink. So anyway, that was the thing that helped her, get away from the refrigerator. But anyway, I really like that sugar monitor because it is great to see where you are. You can see how different foods affect you and so on and so on. And it's not necessarily, everybody's different. Everybody's biochemistry is different. Everybody's different days. We're not the same person we were yesterday. You don't have the same stressors. So, your sugar levels, are going to run different based on the day you're going through and your biochemistry.
Yeah, it seems like provides a lot of great information. Even thinking about it just for me, like you mentioned, how does this food or this load of this amount of food, how do I respond to that and so on and so forth? Thinking of the pizza example. I almost ate a whole pizza this week. Almost.
Yeah. I mean, it's interesting. Pizza, kind of gets a bad rap. I mean, again, it's quantity over quality. Pizza, I tell my patients, okay, so you like pizza. What can you do to increase fiber on pizza? I mean, when I eat pizza, I will or if I get a store-bought pizza, I will load it up with one slice. I'll load it up with spinach, and then I may even get out a butter knife because I love it, and get tomato paste and butter my pizza with tomato paste, put spinach on there, and then drown it in olive oil. Usually one slice is all I need. It does nothing to my sugar.
Wow. So. Piece of pizza, drowned in olive oil, covered in spinach, and you put extra tomato paste on top of it?
Yep.
Fucking Captain Insano over here.
Yep. So
I can see how that would be satiating. No doubt about that.
Yeah, it can be. Hey, Brian, can you turn it off right now?
Yeah.
I have something. So anyway, with the pizza, it's like you can really think about a lot of your foods that way. How can you enhance them with fiber? So that's the way I do that. And when you enhance it with fiber, you will tend to eat less. So that, and you can check with that glucose monitor. Also, I want people to know just even a little bit of weight loss, like if you're overweight and you're diabetic, just a little bit of weight loss, like 2 to 5 pounds does wonders for your health. So, if you are on that trend, let's say you're trying to drop weight, you're doing everything right, but you're only lost like 2 to 5 pounds, you can't get anything off. I mean, you are ahead of the game. I mean, you have decreased your risk of all kinds of things, you know? So I just tell people, I mean, that their benefits include like an improvement in hemoglobin A1C, increased HDL, the good cholesterol, decreased triglycerides, lower blood pressure, and the more weight you lose, as long as you're doing it in a way that doesn't stress your body out, and that's why I love intermittent fasting, the better off you are.
Mm-hmm.
Again, I can't stress enough about physical exercise. I know a lot of people will say and I know you get this too, Brian, people will, the number one reason people don't exercise is because of time. But another reason, especially the older you get, is it hurts. Some people it hurts them. Like their joints don't. I tell people, as far as diabetes goes and as far as weight loss goes, physical exercise is tertiary to lowering the quantity of food you eat and also getting plenty of sleep. All right. So if for whatever reason you just can't exercise, even though we want you to, we know it's extremely healthy. Focus on getting plenty of sleep. Focus on the intermittent fasting and not overeating, and that's going to do wonders for you. If you can get the exercise component in there, great. I mean, you definitely should. Exercise is not. I think the studies are pretty much shown that it's not a great weight loss strategy. What it is, though, is once you lose the weight and you are exercising on a regular basis, you tend to maintain that weight. And then we know exercise has so many other health benefits besides weight loss. So just moving, one bout of exercise, just moving, gives you tremendous amount of benefit. Not to mention like enhanced sense of well-being,
Yes. I would encourage, if you have a specific barrier to exercise, like it hurts or this hurts, hit me up. B.WELL Beyond. We can get you on a personal training program that specifically is tailored to what your situation is, and kind of figure out a way to make exercise more attainable for you.
Right. And I've had patients, Brian, that have used you and raved about it. So yeah, I appreciate that. And they love it. So
but I agree with you.
That's important.
It is third. It is third on the list as far as 1, 2 being diet and sleep and kind of like general health hygiene.
Right. So basically what we talked about there, just through all that, we talked about diagnosis and then, lifestyle changes, foods, how to eat, how you should do it and all that stuff. As long as you have this comprehensive lifestyle approach, that is where you can start and end to reverse diabetes. Okay. If you're really good about it, it's the lifestyle that makes the most, has the most bang for your buck. It saves you money. I mean, I tell people you save money by intermittent fasting. You're not eating as much.
Mm-hmm.
I've seen that. And then getting plenty of sleep. It helps with stress. I mean, it helps optimize hormonal control. It just
saving money there. You're not awake to spend.
You're not.
We're putting you on the lean diet.
Exactly. And then also when we did our sleep cloud test, we talked about like people that don't sleep well, that frontal cortex, prefrontal cortex, they don't make great food decisions either. That willpower battery is not there. So when they're stressed, they're going to tend to stress eat. When they see things that they probably shouldn't eat, like, I don't know, rice cakes or crackers or cookies, they're going to be likely to eat them more so than somebody who gets a good night of sleep.
Yeah, especially in those late hours. I know that from, my experience in school, Keoni, is just when you're up late studying, that's when, 2, 3, 4 a.m., that's when all of a sudden you're eating a Pop-Tart out of nowhere without even consciously controlling it. Right. And I think part of that is you're just begging, your body's begging for some energy to keep you going. Right. And nothing looks better than that crispy little Pop-Tart.
Right. No, you're exactly right. So the lifestyle stuff is really what we want to focus on. Okay. Now that's the foundation of my therapeutic order right there.
Right.
The next rung up from my therapeutic order is now let's think about nutraceutical treatment. And unfortunately, nutraceutical treatment, you have to spend some money, but it pales in comparison to other things. And I recommend everybody, you know, and all my well plans, just about, with very few exceptions, I just think somebody should be on a multivitamin and fish oil at the very least. But for diabetics, I want them on a very specific multivitamin. And one of my favorite multivitamins, there's a number of them out there that are specifically made for people with blood sugar issues, prediabetes, and diabetes. And what should be in that multivitamin is something called, and there's a number of things that are there, but one of the things that's included in this multivitamin, the multivitamin I use mostly for diabetes, and unfortunately it's 6 pills instead of 1 pill. For diabetes, but yeah, but it's worth it. And it's the multivitamin I take. I do the 6 pills a day anyway.
Okay.
It's called Metabolic Synergy. It's by, I think there's a number of them out there that are similar. The one I use is by Designs for Health, and I use some others, but that's the main one. It has a compound in there, a chemical called methylthiamine. It's a type of B vitamin, and it's a relative to B1 thiamine, which is also in there. But what it is shown to be an anti-glycating nutrient, right? So that's really important. You have high blood sugar, you don't want that sugar binding the proteins and creating inflammation. And benfo, so BENFO, thiamine, TIAMINE, is one of those B vitamins, type of B vitamin that can help. So here's some other benefits with it. So there's a clinical trial of 165 patients with diabetic neuropathy. So one of the things about sugar, one of the first things, if your sugar levels stay high too long, you're going to have neuropathy. And neuropathy sucks. I mean, your nerves, you get all kinds of weird sensations in your nerves, usually the feet, sometimes the hands, but usually the feet, burning sensations, cold sensations, pain, or whatever. Well, this particular nutrient, after 6 weeks of people being on it, it reduced diabetic neuropathy pain. And, you know, the doses range from like 600 to 300 milligrams. Anyway, this particular multivitamin has good doses in there that can help with that. We also see that it helps with endothelial function. You know, if you have endothelial dysfunction, which most people do with diabetes, then you're going to have certainly inflammation, oxidative stress, and possibly increased blood pressure. So it helps with that too. Very safe thing to take. So that's one of the nutrients that is an anti-glycating nutrient. Another anti-glycating nutrient that's also found in the diabetic multi that I use is called carnosine. Carnosine is a peptide, and so it's protein, and it's a carne nutrient. People go, well, yeah, carne means meat in Latin, so on and so on. So doesn't that mean meat is great? Yeah, there's carnosine in meat, but you can't get the amount of carnosine from eating a meat-based diet that we want you to get. That's in this, you know, in nutraceutical treatment. But carnosine also inhibits the formation of AGEs, right? So advanced glycation end products, we talked about, it inhibits that. So it reverses glycation just like the methylthiamine does also. It has just shown that, at least in vitro, that it improves the ability of cells to survive in the presence of high glucose concentrations. It improves wound healing in diabetic animals. If you're diabetic, one of the things that is going to happen to you, at least in the long term, it's very difficult to heal. And that's unfortunate, right? Because a lot of people who may need surgery or whatever, that's a significant complication for somebody that, you know, for somebody who needs surgery, where you're just not going to be able to heal. And it's like, some doctors would be like, well, we need to make sure we get this under control before we even do, you know, a possible necessary surgery.
Right. Or what I see all too often, Keoni, is diabetic neuropathy, stepped on something, small little cut, didn't notice, didn't feel, gangrene, necrotic, and the foot's gone.
Right.
Just like that.
And that's what happens. Like when it gets bad, you can, you know, you're going to be prone to amputations. Like
I've seen it 40
if you have
plus times.
Yeah, you have a long term. I mean, that should be part of the treatment for diabetes, is go on to a diabetic ward and look at that, and it will help, you know. I don't like using fear as motivation, but it can certainly help people be like, this is serious. The problem is it's very insidious. It happens over years
Hmm.
usually,
Hmm.
and you just don't catch it until, you get that blood test and you're diabetic. And some people don't feel it, so they don't see how damaging it can be.
For the average human, Keoni, thinking me, we'll call it just a male 30-year-old, when should I start doing that kind of glucose monitoring, glucose testing?
Oh, I think
Never too early.
it's never too early. I think any insight or clarification you can get on your metabolism and how you react to foods is really beneficial. I think most people 20 years from now, just like we carry phones around,
Hmm.
I mean, we're gonna have or we wear, like I wear my Aura ring for assessing my sleep and exercise.
Jesus
We're gonna
Christ,
have
Keoni, we're
sensors
never
on
going to get
us.
a sponsor.
Yeah, yeah, no, right. Well, hopefully they'll sponsor us. But anyway, I think these things are going to be part of our clothes, so to speak. They'll assess,
Yeah.
our metabolism and
Especially
our.
as these become, as it becomes more prominent, which obviously things like diabetes are super prominent, but we saw it with like even COVID. The next round of those Apple Watches had a oxygen saturation
Right.
reader automatically in them. So
You're
we'll
gonna
probably
see
get
them.
lots of things like that, especially
You're
as
gonna
we
see them
tend to
come
get
more and more.
sicker.
Hmm. Yeah, I think
Fortunately,
these things. I'm waiting for the ones that are going to be assessing sugars soon. I mean, I think that's just right around the corner, like literally months away.
yeah,
Um,
I'll get you
where
one
it's
for
part of
Christmas.
where it's part of your phone. Yeah, thanks. Where it's just it's like part of your phone or whatever. But again, it's right there. But they're standalone products like that the glucometer we were talking about. You can go pick that up now. And I think it may be. I think now you need a script for that 14-day glucose monitor, but I'm pretty sure that it's going to be pretty much open to anybody pretty soon, where you don't need a script to get it.
Do you have to go to a practitioner to get it implanted or
No, you can do it
placed?
yourself. You can do
Okay,
it yourself. I mean, some people come to me so I can do it. It's very easy to put on.
okay,
But if you have any question about it, putting it on, then
sure,
it's
certainly.
something easy that I could tell somebody how to do it over the phone. But the instructions on are pretty clear. I think if you get it through your doctor, though, a lot of times maybe it could come to your doctor and you go there and just get it implanted. Show you the first time, get it attached to you, and then after that you can do it yourself. The next nutrient is called pyridoxal 5-phosphate, and this is basically the bioactive form of vitamin B6. It is also an anti-glycating agent. So think about these are exception of carnosine. These are B vitamins, two B vitamins, forms of B vitamins that we talked about. Um, so it's very important. And in this multivitamin, the metabolic multivitamin for diabetes, it has all these B vitamins in it, along with the others that they work together, like folate and B12. And um, folate, B12, along with this pyridoxal 5-phosphate, improve sensation, improve diabetic neuropathy for one thing. And then it also decreases the concentrations of, the toxic AGEs compounds that can be in your blood if you have excess blood sugar everywhere. And here's the other thing that I use this for, which a lot of people haven't really heard of, but this is one of the B vitamins that can lower blood lipids, can help lower blood lipids to a certain extent. There's certain forms of it that can do that, but also it will, not only does sugar bind to proteins and cause like these age products, but also they'll bind to lipids. And this one has been shown to help prevent lipid advanced glycation end products. Then another one that I tell people about, that is also in part of my treatment, and it's in the multi that I use, is things that are called insulin sensitizers. So a lot of people have heard about chromium, and chromium is a trace mineral. It's essential for carbohydrate and fat metabolism, and it's basically insulin sensitizing agent. So it helps your body become more insulin sensitive. It's part of the multi that I give to my diabetic patients. It has been shown in studies to significantly lower hemoglobin A1C. So that's great. It improves glucose control. So that's a great one to use. Part of my foundational stuff for my people, as I said before, is a multivitamin and fish oil. Fish oil being omega-3 fatty acids. Lots of incredible research, tons of research on omega-3s. They promote weight loss. They can enhance insulin sensitivity. They reduce inflammation. They've been shown to reduce death from cardiovascular disease. And also there's a little blood thinning effect to them, so they can reduce clotting. It's part of my foundational supplemental program. So it's basically the multivitamin. If you're diabetic, you get a certain multi, the diabetic multi, and if you're not, you get a regular multi, and then along with fish oil. The amounts that you want to supplement with fish oil is 2 grams. I'd say just 2 grams of EPA, DHA combined. These are the fatty acids, the essential fatty acids that you want in the fish oil. All fish oils have different ratios of them, but a lot of fish oils don't have enough, at least 2 grams. Some fish oil, to get to 2 grams, you have to take like 6 to 8. The lowest amount that I've seen and the one that I use is 2 gel caps, and that will give you 2 grams of the EPA DHA. So you want to make sure you're getting a high concentration of essential fatty acids.
Right.
All right. So another thing that should be in this multi, and I will actually use extra of it also, is magnesium. We've talked, we talked a number of times about magnesium. Magnesium is involved in more than 300 metabolic reactions. It plays a very significant role in carbohydrate metabolism. It participates in everything from insulin secretion and function to testosterone levels to hormone optimization. It's very important. Is there been a podcast where I feel like that we haven't at least mentioned it once somewhere along the way, but
yeah, we probably got it even into the cryptocurrency episode.
Yeah, don't forget about your magnesium. Yeah, that's right. We probably did. Low magnesium levels are significantly common. I mean, in people with diabetes, most people are subclinically deficient anyway. If you have low magnesium levels, you are more prone to glucose intolerance, insulin insensitivity. The higher the magnesium intake, it's closely correlated with the lower your risk of developing type 2 diabetes. So this is another reason, right? This is why I say magnesium, 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 because it's a good preventive for a number of things, not to mention helping with cardiovascular disease. It's been shown to lower, again, glucose, lipids. Magnesium is one of my favorite minerals for lowering blood pressure, right? So it goes hand in hand with diabetes, high blood pressure. One of the labs that we talked about that I run always is at HSCRP, a high sensitivity C-reactive protein marker. It's an inflammatory marker. Well, magnesium has been shown to help lower that. Significant, plays a very critical role in cardiovascular health. So magnesium levels, most people should be taking magnesium, and there's different forms out there. There's a good amount of the magnesium in a diabetic multi, but I always like to give extra. I will dose magnesium anywhere from 400 milligrams, depending on if they're getting it from other sources, all the way up to 1,200 milligrams. Okay. So it's one of those go-to things that people should definitely think about doing, and shouldn't ignore it. Magnesium should be like something that people should be on. If they don't want to take a multi, take magnesium. But a multivitamin is my foundation. So another thing that is been shown to help is green tea. Lots of studies on green tea, especially the EGCG, which is epigallocatechin 3 gallate. It's the main compound that's been researched. Green tea has been shown to lower glucose, insulin levels. This is stuff you can add to your diet. Drinking green tea, you can use it in water, make your tea. It decreases fatty liver accumulation. It improves mitochondrial function. At least in animal models, it's been shown to protect against diabetic retinopathy. One of the things with diabetes, not only do your nerves go bad, but your eyesight can go bad really quick. So this is one of the things that can help with it. Let's see, one study, 16-week randomized controlled trial, 92 subjects, all had type 2 diabetes, blood lipid abnormalities. They took 500 milligrams of green tea extract 3 times a day. The green tea group showed significant increases in insulin sensitivity. HDL levels also were increased, and then they also showed a significant decrease in triglycerides. Tons of studies that kind of show similar things on this. So
Right.
these studies have been reproducible. Has a positive effect on blood pressure also. So that's one thing that you can certainly add to your diet. Another thing that you should certainly add to your diet, it goes well in a number of things, especially like cereal. I use a lot of it on my cereals. If I eat, I get a kind of paleo cereal, one that fits that nutrition label rule, and I'll put cinnamon on it. So cinnamon is a great spice to help with blood sugar control. It's been shown to promote healthy glucose metabolism. Again, it improves insulin sensitivity. Studies that supplemented with 1 to 6 grams of cinnamon in diabetics and healthy individuals showed optimization of fasting glucose, hemoglobin A1C. Also, after meal glucose and insulin concentrations also were improved. And these have been shown to improve even in people already taking glucose lowering medications. So that's pretty cool. So cinnamon is it's a safe thing to take. I mean, where do you get it? You just go to your store, get it out of the spice rack, add it to where you need. Cinnamon goes well with any type of, I don't know, you name it. I mean, it can go well in like steel cut oats, which has a lot of fiber in it. It can go well, if you wanted, it goes well on any type of keto type ice cream or even regular ice cream. If you're going to do it, you can enhance it like we did with the pizza by putting that in there. You can certainly play with your spices. So cinnamon's the standout, at least as diabetes goes, but there's a lot of them that can help. And some other ones that I want to mention are cocoa powder, cardamom, basil, oregano. Another one that seems to help is clove bud. People know what clove bud is, right? I mean, you see it in like Christmas time and Christmas hams or whatever, maybe even turkeys anyway. It's a spice that has shown to aid in overall metabolism. It's funny with clove, I actually will have patients because it has a numbing effect if you suck on clove bud, and it used to be the old timey spice for numbing out your teeth if you're getting them pulled or having any dental work. It was the numbing agent used in some quarters of the world, so to speak. And it's pleasant, makes your breath smell great. It actually can help reduce bacteria in the mouth if you suck on it, and it also can have positive effects on your metabolism. It's just another spice that you can use. There is, you can also get it in pill form if you wanted to do it. Let's see if I can find, okay. So a clinical study on human subjects. After 30 days of supplementation with 250 milligrams per day of a water extract of clove, participants had lower after meal blood glucose levels. So that's pretty cool. And even if they had high blood glucose levels, they seem to have better overall reductions over time after glucose meals, high glucose meals. So it helps the liver become a little bit more insulin sensitive too, which is great. I mean, you want to keep your liver healthy. Another nutrient that I use that I think is very important because people with diabetes are going to be very prone to fatty liver, something to just support liver health besides everything else we talked about, is N-acetylcysteine, We talked about that on our glutathione podcast. N-acetylcysteine is a precursor to that. It helps protect the liver as well as a number of other organs in the body. So it supports your body's main antioxidant, which is glutathione. So I use that about 600 milligrams a day with that. And what else do we need to talk? There's a number of other things that I will use. One thing that you can actually think about using is bilberry extract. It's a type of blueberry. It's rich in polyphenols and anthocyanins. In diabetic mice animal studies, it's been shown to reduce blood glucose and enhance insulin sensitivity. Blueberries are a great fruit for diabetics. Again, you don't want to overdo it, but blueberries don't seem to spike your sugar as high as some other fruits can. And that's why I really like that glucometer, because you can really get an idea of what fruits do what to you.
Right.
But blueberries are good, but I use extracts of a lot of these berries that can help people. It's not my main thing that I use right away, but it's something that can help tremendously. Some of the other things that I tell my patients about are there's certain compounds in natural substances that are basically what I call sugar inhibitors or amylase inhibitors. And basically what they are is, for example, in white mulberry leaf, and people may know this that know about the nutraceutical industry, but white mulberry leaf is one of these extracts that has been shown to, when you eat a carbohydrate meal, it inhibits the enzyme amylase in your gut. And what it does is it inhibits it from breaking down the starch. So if you don't break down the starch, it passes through you. Another one that does a very similar thing, and it got a bad rap recently for being, being claimed as a weight loss supplement, but green coffee bean extract also acts as one of these kind of inhibitors for glucose. Brown seaweed extract is another one that's also been shown to do that. And then sorghum extract is another sugar inhibitor. So I just tell people, like, really, these are things, this is part of the reason why eating a whole foods diet is really important, because a whole foods diet probably does just more than just fiber. I mean, there's probably compounds in there like that are found in mulberry leaf extract that not only are you getting the fiber in there, but you're actually getting these compounds that inhibit the starch in your meal from being broken down. Mm-hmm. So we have to really think about the phytonutrients in foods to help with that. What else? There's compounds in apples that also have similar things that can help with that. Lowering sugar, inhibiting starch from being broken down. Other things that I will use, and this goes more towards secondary things that can reduce inflammation, help with blood pressure, even though they secondarily will also help with reducing insulin. I'll just name them off quickly. They will also have like this anti-aging effect also. So I'm just going to go through these pretty quick. One of them we talked about on a podcast is curcumin, a great anti-inflammatory. It's great for helping with sugar control and things. There's a randomized controlled trial in pre-diabetic subjects with curcumin supplementation, which significantly lowered the risk of progressing from pre-diabetes to diabetes. So that's just one study on that. Another one is CoQ10. CoQ10, along with magnesium, has been shown to help with lowering blood pressure, but also it is essential for mitochondrial energy metabolism. It's a powerful inhibitor of oxidative stress. A deficiency of CoQ10 has been associated with diabetes. I really like CoQ10 for a number of reasons. I think most people should be on it. One of the main problems I see with it is it can be very expensive as a nutraceutical. Resveratrol, found high in cocoa, wine, peanut skins, that type of thing. It actually it's been documented over and over again. Yes, I will say it. It seems like the fountain of youth, at least part of the fountain of youth, is found in resveratrol. Anytime you can slow down the aging process, any compound or drug that can do that, it's probably also holds tremendous promise for treating type 2 diabetes. And indeed, resveratrol does, even though it's not my first thing that I go to. Lipoic acid is one. Oh, the lipoic acid actually is in my diabetic multi also. Okay, so I forgot to mention that one, but it's a great free radical scavenger. It's been shown to support healthy blood glucose levels through a number of mechanisms. Let's see. It just the one thing I'll say about lipoic acid is just make sure you get the R form of the lipoic acid. There's two forms of lipoic acid. The R form is the more biologically active form. I won't go too much into some of the other compounds, but we talked about bilberry and blueberry extracts. All those are great. Grape polyphenols. Again, this speaks to a whole foods diet, although one of my patients who ate a ton of grapes, I had to get them off the grapes, but the grape skins, grape seeds are great for you. Another thing that's in the diabetic multi is vitamin E. So one type of vitamin E, gamma tocopherol, has, it helps with endothelial function, has anti-inflammatory effects. It should be part of a good multivitamin. The multi that I use not only has gamma tocopherol in it, but it has the other tocopherols in it, the other forms of vitamin E in there that are also necessary. And let's see, anything else? Oh, we'll do a podcast on this at some point, but there's another anti-aging nutrient that has been shown to really, again, the fountain of youth. I mean, these things are not are not fantasy anymore. We do know that resveratrol and a compound called nicotinamide riboside, and also I think nicotinamide mono niacin, or there's another form of this nicotinamide that has also been shown to affect your sirtuin proteins and genes, that it slows down the aging process. Hey, don't take my word for it. There's a wonderful book out there right now from the main researcher on these nutrients. It's called Lifespan by Dr. David Sinclair. He's a Harvard researcher. It's out now. I just finished reading it. I was fascinated with that book, so give a shout out to him. Again, anytime you can slow down the aging process, you are also helping with diabetes, and it's a nice positive cycle. If you can reverse your diabetes or improve your diabetic symptoms and your sugars, you are slowing down the aging process. So I know that's a lot of information. Should we just review it real quick, Brian?
Yeah.
Take like a minute?
Yeah,
All right.
absolutely.
All right. So in this podcast, what we did is we talked about how you get diagnosed with it. The main way they're diagnosing it now is with a hemoglobin A1C. Anything over 6.5 is going to diagnose you as diabetic, especially if you have more than one reading that high, consecutive reading. We talked about lifestyle, sleep. Yep. We talked about food, putting space between your meals. Think about intermittent fasting is very important, and exercise, working your muscles, however you want to do that, swimming, working out, walking, just being active or physical in a job will help you with diabetes. And then we talked about all the nutraceuticals that go with that. A diabetic multi with a lot of the things that I talked about that are high in certain forms of B vitamins, chromium, magnesium, lipoic acid, as well as a number of other things, can really, really help. We talked about the benefits of secondary nutraceuticals, at least for diabetes. It can help with the symptoms and inflammation, but also can help control blood sugar, CoQ10, curcumin, and then anti-aging nutrients like resveratrol and NAD, so nicotinamide riboside. is really great. And you can find these things in supplements over the counter and so on and so on. Hey, and don't forget about your herbs, and the main herbs you would have access to that are just in your grocery store are your spices. So cinnamon, clove, cocoa, those things have been shown to help. Then you can come to somebody like me and I can talk about specific herbs that are not really considered culinary by any means, but medicinal herbs that can also help. So that was that in a nutshell. Next time, podcast 3, we're going to go over the medications, and some of those medications can be extremely beneficial for people. So we'll talk
Good
about it
deal.
next time.
We'll talk with you
Yeah.
guys next week. Until then, be well.
Yep. Be well. Take care.